Rural health care is one of the major issues facing Oklahoma's next governor. While on the campaign trail, the candidates are floating their ideas to help heal health care.
It's no secret rural hospitals in Oklahoma are struggling. For example, the Pauls Valley Regional Medical Center is living day to day. Facing a lawsuit with the hospital's previous management company, the medical center is struggling to keep its doors open. It's asked for the community's help.
We've raised a little over $125,000 to date just on the what we call the Friends and Family raise. We haven't had any large corporate donors. We are speaking to a number, and I think we're getting closer and closer to those who are in the neighborhood that have a vested interest in keeping this hospital open.
Pauls Valley Regional Medical Center caught national attention for starting a GoFundMe account to keep operating. CBS Sunday Morning will be producing a story framing the hospital situation with rural health care in America.
And they're going to do an in-depth expose on this hospital and how that ties back into the crisis we have in rural health care today.
In Oklahoma, rural hospitals have been on the razor's edge. Their possible failure means many Oklahomans will have to travel further for their health care needs. The president of the Oklahoma Hospital Association says the uninsured in rural Oklahoma are a major impact to the bottom line of hospitals.
Smaller hospitals in rural Oklahoma have more uninsured. So let's make no mistake, uninsured folks, when they can't afford insurance, they end up in the emergency room, and unfortunately, sometimes very late in their illness. So it may be very, very costly from there.
And the state's budget woes trickled down to the hospitals.
It's important to remember since 2010 that with the state budget crisis, hospitals, through a cumulative effect of budget cuts year over year, until this last year, we were looking at about an 18% reduction overall since 2010 in hospital rates.
And decisions made by state leaders have put even more financial strain on rural health care.
Proportionally, our rural hospitals are struggling more financially because some of the decisions that our state made, specifically in the Affordable Care Act, hospitals agreed to a cut in their Medicare rates in exchange for more people getting insurance under Medicaid. Oklahoma made the choice not to accept those federal funds.
The problems are catching the attention of candidates running to be Oklahoma's next governor. Democratic gubernatorial candidate Drew Edmondson wants to expand the number of insured in Oklahoma by accepting federal funds.
I'm here to tell you, if you do not know, that one of my priorities, if I'm your next governor, is to opt into the Medicaid expansion.
Edmondson acknowledges that option is only a first step to alleviate issues facing rural health care in Oklahoma. However, he believes the Medicaid expansion would help a lot of Oklahomans who are struggling with the cost of obtaining medical insurance.
That's about 153,000 Oklahomans spread across the state who earn too much to qualify for Medicaid, but not enough to opt into the insurance pool or to purchase private health insurance.
Edmondson says the current health care situation in Oklahoma really amounts to inequality of care.
And that is a problem that plagues all hospitals, but it has a particular impact in rural Oklahoma because in the urban area they have a volume that helps them compensate for the lack of compensated care.
While Edmondson supports Medicaid expansion, his Republican opponent Kevin Stitt does not.
That's not the right thing for Oklahoma. Obviously, we want any federal dollar we can get in our state for roads and bridges or for our healthcare system. But we also have to be very careful at putting more people on a system that then we remove federal dollars from it, and then we're stuck holding the bag.
He feels opting into Medicaid expansion could have unintended consequences, but would rather use existing federal funds to help rural hospitals and long-term care facilities.
So that's why I'm not for the Medicaid expansion as it sits. And there's going to be about 181 million more in federal dollars coming into our system this year if we can hold our expenses where they're at. I'm committed to getting that into our rural hospitals and into our nursing homes, because we've lost about 20% or 25% of our nursing homes over the last decade. That we've got to turn that around.
Stitt has an eye toward the Oklahoma Health Care Authority and re-examining its approach to the Medicaid program.
They currently spend about $5.5 billion right now, and they're kind of managing our Medicaid program. We haven't really re-audited those roles. We need to get on top of that and make sure that we don't continue to cut reimbursement rates. We've got to be able to deliver better services.
We reached out to Libertarian Chris Powell to discover his stance on rural health care. His campaign did not respond to our request. Whoever wins the governor's mansion in November will face the challenge of getting a relatively inexperienced legislature to work with his administration to address the issues facing rural hospitals in Oklahoma.